Click on got it, sir.
Yeah.
So, sir, it's 3, 2, 1. Over to you, sir.
Namaste. I am Dr. Narayan Banerjee, consultant physician working at Apollo Multispecialty Hospital at Kolkata for last 30 years. I will briefly tell you about the burden of heart failure in India and how to manage this burden in your language. You know what is heart failure is? We know that heart is pumping every minute 60 to 100 times. But when it pumps, it usually gives us enough blood to every territory of our body. But when there is heart failure, that means when heart is not pumping adequately, we are calling as there is heart failure. So what happens? The target organ, which is supplied by the blood, we are totally depending on the blood flow, that are deprived of our circulation. So what are those target organs? Number one is brain. Number two is definitely our kidney. So these two are target organ, and number three is our liver. And you have to know this heart failure can be divided into acute heart failure and chronic heart failure. And also we have 4 chambers in our heart. We can say it's a right heart failure, or we can say it's a left heart failure. So depending on the type of heart failure, we'll manage heart failure accordingly. So you have to know about the chronic heart failure, because acute heart failure is an emergency. That if you have sudden shortness of breath, you never experience that shortness of breath in back. That is the acute emergency. I am not discussing about that. And another thing, when the heart is failing, either left-sided heart failure, you know that left heart, the aorta originates from the left heart, the main artery, which is going through blood supply to our different parts of the body. That is the left-sided heart failure. So what is the right-sided heart failure? Right heart is actually pumping out the carbon dioxide mixed blood to our lungs and get the oxygenated blood, which is again pumped into the left side of the heart. So if you have right-sided heart failure, our venous system, which is containing mainly carbon dioxide containing blood, is getting congested. So you are having more of swelling, bloating in that type of heart failure. So this is the brief introduction. But you know what is the burden of this? We know India is the second largest, or possibly now the populous country in the world. We are having approximately 1.144 crore people in India. We have crossed China few days ago. So 1% of our population is suffering from heart failure. That is nearly, you can say, there's a huge number of patients who is suffering from heart failure. Moreover this, why Indians are more susceptible to heart failure? There are a lot of things you should remember. One is, number one, diabetes. If you think about diabetes, right now, 7.7 crore Indian are diabetic. And all uncontrolled diabetic patients, they are more prone for heart failure due to two reasons. One is diabetic produces weakness of the heart muscle, that produces diabetic cardiomyopathy. And number two, diabetes itself produces Stiffening of the coronary arteries, that is called atherosclerosis, and that induces coronary artery disease. So number 1 is diabetes. Number 2, coronary artery disease. India, rather Southeast Asia, has a peculiar gene which is more atherogenic than other genes. Why? Because this gene produces low density lipoprotein, which are actually bad cholesterol, which produces more atherosclerosis of the blood vessels throughout of the body. So Indians are more atherogenic than other population in in Western country. So Indians by genetic nature, they are more susceptible to heart failure. So apart from genetic aspect, there is some environmental aspect. We know with civilization, lot of pollution and lot of bad things appear in our day-to-day practice. Like we are more habituated with our sedentary habit. We are taking junk food. We are not exercising. We used to smoke. We take alcohol. We are taking all the bad cultures from the Western population, but we are not taking the good culture from the Western population that is working. You have to be active to remain healthy. That is the main thing. So, number 1 is diabetes. Number 2 is coronary heart disease. Number 3 is genetic factor. Number 4 is obesity. Obesity itself producing heart failure, because your heart is capable of pumping say 80 kg body weight. Now you are obese due to your sedentary habit or taking junk food. You are becoming more gaining weight and producing more stress to your right side of the heart. So that produces heart failure. Now smoking. Tobacco smoking, India possibly the largest population is taking bidi, and by strictly prohibiting this smoking, we can reduce heart failure to a great extent. Definitely, these are the modifiable factors which we can do in day-to-day practice. So, what are the stages of heart failure you all should be aware of? Number 1, stage A. That means you are having all risk factor for heart failure, but echocardiographically there is no structural change. That is, you are obese, you are diabetic, you have COPD, you are a smoker, taking moderate amount of alcohol, you are atherogenic, you are having metabolic syndrome, but luckily echo is normal. That is stage A, asymptomatic. Stage B, with all these things, you are having some structural changes in the heart. That is either left ventricular dysfunction or right ventricular dysfunction, or the hypertrophy of the heart muscle. That means your muscles of the heart is becoming more bulged. It is more hypertrophied. So that produces heart failure stage B. Stage C, you are having all the features suggestive of stage B of heart failure. In addition, you are symptomatic. You are feeling dyspneic, you are having shortness of breath with usual work, you are having edema, that means swelling in the leg, and shortness of breath, especially when lying down. And stage D means despite of best possible treatment, you are having shortness of breath even at rest. So we know there is 4 stages of heart failure, and our aim is to prevent heart failure from the beginning. And if you have heart failure, treat as early as possible. So first, how to reduce the incidence of heart failure in our country. This is up to the policymaker, as well as you have to increase your awareness about the cause of heart failure. What policymaker will do? They will strictly produce some sort of restriction to all nicotine containing substance. Say no to nicotine. If you go to US, there's hardly any place where you can smoke. The smoking zone is very restricted. But in our country, BD is taken by each and every, if not the every house, alternate house. And biomass pollution, that is another thing that is equivalent to BD. In our air quality index is something around 200, where other country it is less than 50. So that is equal to the same type of pollution related airborne disease that produces lung and heart problem. So who are the policymaker can strictly reduce our pollution level by proper method. And what you should do, what we should do as a citizen of India. Number one, never be sedentary. Walk for half an hour per day. Doesn't matter if you have no time in the morning, walk in the afternoon. But walk brisk if possible. If you feel you are not feeling very comfortable with brisk walk, walk as far as practicable. That is number one thing. Limit your carbohydrate intake. We are Indian, mostly depending on carbohydrate. But believe me, it's better you take 50% carbohydrate and 30 to 40% from protein. You may say the protein is a very costly thing. Who said that? You can take lot of dal. You can take other source of protein. You can take even limited amount of egg with egg yolk and egg white daily, so that to increase the protein. So you will get balanced amount of food. You take a lot of green vegetables which are abundant in our country. You take fruits, seasonal fruits, no need to take something very costly food. So you make your diet plan in such a way so that you can avoid weight gain. Please avoid soft drinks. Please stop smoking. Stop taking tobacco from tomorrow only. And you yourself check your blood sugar. If you have glucometer, check blood pressure by your digital blood pressure machine. And there are a lot of study. It says that if you can control blood pressure, and I have not told previously, blood pressure is a major thing which is contributing heart failure to Indians. Actually, 30% of Indians are hypertensive. If we can control the hypertension, systolic blood pressure by 1 to 2%, that can substantially reduce the incidence of heart failure in our country. So there are a lot of medicines also. I'll come to the medicines later, but first of all, you have to be aware of what are the causes of heart failure, why it is increasing, why government is also very anxious about this heart failure, because this will produce tremendous burden to our healthcare system, and our healthcare system will really will be jeopardized if the epidemic of heart failure continues. Now, how to treat the heart failure? Now, if you are in the stage A hypertension, stage A heart failure, that means you have all risk factor. What you cannot avoid, the genetic risk factor. But You can avoid smoking. You can avoid taking junk food. Yes, once in a blue moon you can take biryani, but not daily. Take lot of fruits, take green vegetables, walk for half an hour, try to live a healthy life. Take good quality sleep. That is also very important to control your blood pressure, to control your blood sugar also, and to control your weight. Number two, if you have modifiable risk factor that can be modified by giving medicine like antihypertensive, we call it angiotensin converting enzyme inhibitor, ACE, ARB, beta blockers. These are the good medicine which is taking care of the heart as well as blood pressure also. And diuretics. In our country, diuretics plays a good role to control blood pressure because it is cheap and it really does help in heart failure. You are diabetic, you are at risk of heart failure. You are hypertensive, you are at risk of heart failure. Take proper anti-diabetic medication. Choose the anti-diabetic medication which improves heart, which prevents heart failure. There are a lot of medicine which is now becoming available in a generic version, which is not very costly. So take those medicines of diabetes, like I can tell that you can take SGLT2 inhibitor that actually takes away the sugar from your blood to the kidney so that you can reduce your body weight as well as it produces some sort of dehydration and which prevents heart failure. And moreover, whenever you can, you just take meditation, you take the help of yoga. This is will improve your inner strength. Number four, if you have second stage of heart failure, continue all those things and you may increase the dose of antihypertensive, restrict water intake. And in some cases, you may use some artificial device also that is more practical in a patient who are having stage 3 of heart failure. Stage 3 of heart failure, most of the people, they are dying due to heart failure as well as due to arrhythmia. What is meant by arrhythmia? Heart, you can say, it's like a house. It has its own chamber and it has its electrical circuit. So in heart failure, that electrical circuit occasionally beats bizarrely and that produces sudden cardiac death. So if you can implant a ICD, that improves your heart failure. And stage 4, you need to be very aggressive about the treatment. So we know these are the basic things we should do. And before we end my story, how to manage this heart failure, never forget to get yourself vaccinated. This is the most important and most neglected part in our country. Adult vaccination is mandatory. Those who are hypertensive, who are diabetic, please take annual influenza vaccination. Those who are living in Bengal or in Uttar Pradesh or Bihar, they should take in the month of April or May one influenza shot. And those who are living in Jammu and Kashmir or in the southern state, Tamil Nadu, they should take in the month of September, October because of the antigenic variation of the influenza viruses. Number two, they should get vaccinated against pneumonia because pneumonia is one of the factors which produces heart failure, and very common pneumonia is pneumococcal pneumonia. So you should be getting vaccinated against influenza, vaccinated against pneumonia, and vaccinated against herpes zoster. And yes, most of us forget to take vaccination against diphtheria, pertussis, and toxoid. In most of the cases, these vaccines are very effective, cost effective for ourselves. So, to conclude my lecture, I all wish you healthy life and healthy future and healthy India.